Thank you all for being here. My name is Mark McLean, and I'm the Minister of Health and Wellness for Prince Edward Island. Joining me today are the President of the PEI Medical Society, Dr. Castle, and the CEO of Health PEI, Mel Fraser. Today marks a pivotal moment in the history of our healthcare system. It is with great pride and optimism that I'm able to announce the ratification of a new $187 million agreement with our island physicians. This agreement is more than a contract. It is a comprehensive commitment to valuing our physicians, enhancing primary care, and ultimately building a stronger healthcare system for Islanders. This new 5-year agreement represents a $187 million investment in physician services. For perspective, the last 5-year agreement saw $37 million invested over 5 years. This is an historic agreement. This is the most we have ever invested in physician services. This agreement puts PEI above the national compensation averages in almost all specialties and puts our family medicine physicians in the top 3 for all of Canada. We are putting PEI in the map as the ideal place to come and practice medicine. This agreement is about supporting our current physicians, retaining them, and working with them to provide better health care for Islanders, as well as recruiting more physicians to come and join our team. For too long, our physicians have been burdened with excessive administration. With this new agreement, we are reducing these administrative tasks for physicians. Less paperwork means more time for patients. We are simplifying fee codes. We are going from 450 fee codes to approximately 30. We are simplifying billing systems and increasing flexibility. By removing red tape, doctors can focus on what they do best, caring for their patients and our loved ones. One of the most significant aspects of this agreement is the unprecedented investment in family medicine. Across the country, in every jurisdiction, we're seeing fewer physicians choosing family medicine and more going into specialty practices. By focusing our investment on family medicine, which will be an upwards of a 47% increase, we are narrowing the income gap between family medicine and other specialties. This will support recruitment and also retention of our existing family physicians. We all know that this will take time. This is about creating lasting improvements that will benefit Islanders for years to come. As part of this new agreement, we are also investing in a panel incentive program. This program will reward family physicians who go above and beyond their panel size, taking patients off the registry. In the past 6 months, we've been able to sign 32 new physicians, and we want to build on that momentum. This new agreement, as well as our EMR, our patient medical homes, our collaborative care model, our renewed recruitment efforts, the med school, they're all selling points for PEI as the best place to come and practice medicine. Furthermore, this agreement establishes a groundbreaking partnership between the Medical Society, the Health Authority, and the Department of Health and Wellness. By bringing the Medical Society to the decision-making table consistently, we are fostering a stronger, more collaborative system. This collaborative approach will not only create a more effective work environment for our physicians, but most importantly, will lead to more improved health outcomes for our entire population. We know that access to health care, that is something that is very important to Islanders, and that is why it is a top priority for our government that we are making this historical investment. With a more satisfied and supported medical workforce, we can expect shorter wait times, more comprehensive care, and overall enhancement in the healthcare services that we provide. This is a victory for every patient, every family, and every community in our province. Finally, I want to thank Dr. Castle and her team, Health PEI, Melanie, and your team, and every physician who took the time to provide feedback, input, and collaboration into making this agreement a reality. Today's ratification of this transformative agreement is a testament to our unwavering commitment to healthcare excellence. Thank you all for being here, and for those watching online. And at this time, I'd like to invite Dr. Castle to the podium to say a few words on behalf of the Medical Society of PEI. Thank you.
Thank Thank you, Minister McLean. Good morning, everyone. I would like to acknowledge that we're meeting today on the traditional unceded territory of the Mi'kmaq people of PEI. We recognize and respect the enduring presence of Indigenous people on this land, and we acknowledge the painful history of colonialism and the ongoing struggles for justice and reconciliation. On behalf of the Medical Society of PEI and PEI physicians, it is my pleasure to be here with you this morning to celebrate the newly ratified Physician Services Agreement. Despite a summer vote, we were pleased that 80% of eligible physician members turned out to vote, with 84% voting in favor of this new agreement. This new agreement is unique in Canada. It brings about meaningful change and creative solutions. All three parties should be very proud of the achievements of this unprecedented contract. When we met with our physician members before these negotiations began, we asked them what they needed from this next contract. They shared a long and weighty list of their worries and their hopes. And of course, competitive compensation to retain and recruit physicians was on this list. Not surprisingly, however, it wasn't their only priority. They sought clear pathways to improve patient-related problems, recognition for their efforts not always visible to others, ease in transitioning between diverse roles, and the removal of unnecessary complexities from our healthcare system. In short, they wanted support to allow them to do what they do best, which is caring for their patients. So that's what we set out to do. We started with our family physicians, the foundation of our healthcare system. We have achieved an historic course correction in pay to rival the national market, along with a new and simplified payment model that will make PEI stand apart as the place to practice medicine in Canada. We have raised the standard in terms of how we value family medicine in PEI. As physicians, we know that by strengthening family medicine, every other specialty, and most importantly our patients, will be better served and can expect better healthcare outcomes. The new simplified payment model for family physicians is an option for all other specialties as well. For those who know anything about physician payment models, they are complex and the task of getting paid for your work is very cumbersome. This change alone will be highly attractive to the growing number of physicians who simply want to provide patient care and set aside the accounting and business management roles. The new agreement holistically values physicians' expertise and time. Traditionally, only direct patient interactions were recognized. Now, time spent advocating for patients, addressing family members' concerns, maintaining detailed electronic medical records, and ensuring that no patient slips through the cracks will be acknowledged and valued. The reduction in physician administrative burden was also considered throughout the agreement. Many small changes were made, such as fewer steps to access a program or fewer clicks to submit a payment. And I know I speak for all of my colleagues in saying that every effort to reduce unnecessary red tape is appreciated and helps ensure that our time and energy is instead spent allowing our patients to receive the best care possible on PEI. It was also refreshing to physicians to hear that all three parties are committed to ongoing collaboration through the newly established Implementation Management Team. Our system and physicians face complex problems that we can't always predict when we are at the negotiations table. By inviting MSPEI to work alongside Health PEI and government, we can reach a steady state of making the system better every single day, not just during negotiation years. Consistently working together to build a healthier system will result in healthier physicians, which will result in better physician retention, and, always our goal, better patient care. This agreement further elevates our already coveted healthy working relationship that other medical associations across the country aspire to achieve with their government partners. And while a healthy working relationship is rarely appreciated outside of the small circles of our working groups, it is something that we should all be proud of. So on behalf of all physicians in PEI, I am truly grateful to be in a position to see our profession so deeply valued, and I look forward to working with everyone here today, including the media, to showcase PEI as the best place to practice medicine in Canada. And in closing, I would like to thank the many leaders from MSPEI, Government, and Health PEI who spent the last 12 months and hundreds of hours designing this landmark agreement. They sacrificed time with their families, missed milestone events, and worked through many an evening and weekend to ensure that this agreement could come to fruition. On behalf of the physicians of PEI and their patients, we are deeply grateful. Thank you. I would next like to invite Health PEI CEO Mel Fraser to say a few words. Thank you.
Thank you, everyone. And thank you, Dr. Castle, for the lovely land acknowledgement as well. Minister McLean, thank you. And welcome to everyone here and viewing online. I'm absolutely delighted to stand here today as we really celebrate what is a significant milestone. And as Krista mentioned, one that was a lot of hours and a lot of work went into, and a lot of great thought and passion. So very, very happy to be here to celebrate with you. This agreement really does show us the progress that we can achieve when we work together. The government, Prince Edward Island, Health PEI, and all of the people working in the healthcare system together make progress. And I'm thrilled to now be a part of working together with you. This is an absolutely pivotal moment in our mission to deliver excellent health care to the people of PEI. Across Canada, we know that all of the provinces are facing similar challenges in recruiting and retaining physicians, and PEI has been no exception. Our priority, and certainly my priority at Health PEI, has been to provide access to care for people. This new agreement, this 5-year agreement, is one of a suite of steps, but certainly a bold step in that direction and towards reaching that goal. By significantly improving our physician compensation and the benefits we provide to physicians, we're creating that attractive environment for medical professionals to choose PEI as their home and their place to practice. We are on the path to making PEI the best possible place to practice medicine. This goes beyond compensation. I think, as you heard, the agreement has really prioritized reducing bureaucracy and administrative burden. We know administration is an important part of work, but a lot of physicians want to practice medicine, and we have to make it a priority to allow them to practice their work and their passion. And this agreement allows them to find that right balance and to spend the time prioritized with their patients and working with their communities and clinical teams. The agreement also supports the retention of physicians by establishing that sustainable work-life balance, so providing enhanced parental leave, vacation benefits, stipends to importantly continue with medical education. We're demonstrating our commitment to supporting the well-being of our healthcare providers, which means they can support their commitment to staying in our communities and taking care of our communities. The commitment to the whole life of our physicians is essential to attracting new doctors, but more importantly, to ensure that those who've already come, those who are here caring for our communities, feel valued and stay with us for years to come. As you've heard, a cornerstone of this agreement is the significant investment in family medicine and family physicians, and recognizing the critical role that they play in communities and primary care. For those of you that don't know, the best systems, the best healthcare systems in the world have good primary care. It is the cornerstone of good outcomes for patients, good outcomes for families, and the best healthcare systems. This agreement sets us up to be leaders in primary care and team-based primary care, I think not only in the country but across the globe. And I'm so excited for that and what that means for our people. And of course, a critical part of that journey is our growth of our patient medical homes, those collaborative teams of healthcare workers across the province, family physicians, and recruiting new family physicians to those patient medical homes. They're key partners who will work alongside nurses, social workers, physiotherapists, and all professionals to really provide that excellent care to Islanders. So by strengthening primary care, we provide better care, we provide care earlier, and we reduce pressures on other parts of the system as well, whether that be the acute care sector, our emergency departments, but also our long-term care system, allowing people to stay healthier and stay at home longer. So our goal is simple. By offering these competitive salaries and a supportive work environment and a supportive life environment, we aim to ensure that Islanders have access to the care and a physician when they need one. So today we're taking another big step in our journey towards delivering on that goal, and so there's much to be hopeful for on the horizon. I too want to express my sincere gratitude to the Medical Society of PEI for your deep collaboration and partnership and the trust that we invested in each other through the negotiation process to do the best for our providers, but also for the people of the island. Working together, as I said, is sort of a hallmark of how I like to work, but I think it is the hallmark of what created this, I think, historic agreement that will benefit patients and physicians for years to come. And ultimately, that means that we're building a stronger healthcare system that will meet the needs of islanders now and years to come. So with that, thank you, and I'll turn it back over to the minister, and we will be happy to take your questions. And once again, thank you to all the teams and everyone who contributed to this agreement. It's been a journey, but we're here, and we did a beautiful thing for the province of PEI, so thank you.
Thank you, Mel, and thank you, Dr. Castle. So this is an exciting agreement, and I know it will make a difference in the lives of our physicians. It will improve their work environment, their compensation, and it will support our recruitment efforts, placing PEI on the map as one of the top health employers. And ultimately, it will lead to better health access for all Islanders. So thank you for coming today. Together, we are building a better, healthier, stronger, and more vibrant healthcare system. For media in the room, Dr. Castle, CEO Mel Fraser, and I will be available for one-on-one interviews at the completion of this press conference. So thank you very much.